am Professor K.K. Das. Welcome to Uday India Digital Team. We are today at Swami Vivekananda National Institute for Rehabilitation Training and Research in Olutpur, famously known Asia's premier institute catering to rehabilitation and empowerment of people to whom our Honorable Prime Minister has called as divyangjan. With us today is Dr. P.P. Mahanti, Patitapavan Mahanti, who is in this institution for last more than 30 years and has been a student here, has been a professor here, now is heading the institute as the director of this prestigious Asia's leading institute on rehabilitation for specially abled people. Thank you. Let's introduce Dr. P.P. Mahanti. P.P. Mahanti, sir, you have been a pioneer in rehabilitation science and rehabilitation technology. Tell us something about NIRTAR. How is it going on? And NIRTAR has just completed in 2025, 50 years. So in this 50 years journey, what has NIRTAR achieved so far and where it plans to go ahead?
Namaskar. NIRTAR was established in the year 1975. It was established for the rehabilitation of the Indo-Bangla war victims. At that point of time, there was only one institute providing, manufacturing and providing artificial limb for the person with a disability. It was in Safdarjung Hospital, New Delhi. So there was a need for more rehabilitation centers. So in 1975, NIRTAR was established as an artificial limb manufacturing corporation. Then afterwards, it expanded to complete rehabilitation of the person with the locomotor disability. It came under the administrative control of Ministry of then Social Welfare in the year 1984. Then there afterwards in 1987 various long-term courses started like Bachelor in Physiotherapy, Bachelor in Occupational Therapy, Prosthetic, Orthotic. Then in 2002 various master degree programs started like Master in Physiotherapy, Occupational Therapy. Thereafter, we have a 100-bedded hospital we had at that point of time where rehabilitation surgery was done. We are famous for this reconstructive surgery or deformity correction surgery, which, all across the country, we are the premier institute for complete rehabilitation of the person with locomotor disability. We have well-equipped physiotherapy department, prosthetic orthotic department, occupational therapy department, speech and hearing department, and two modular OT there with all accessory facility like patho lab, X-ray, and the plaster room, the minor OT, etc. So those who need deformity correction, either by therapeutic means or by surgical means, the deformity is corrected, and those who require aids and appliances or artificial limb, that is also manufactured in our prosthetic orthotic department, and it is being provided to the patient. And recently we have started skill training also to person with a disability. Our aim is to make the individual independent, not only physically, economically also, so that he can return back to the society and have a dignified life, worthy life in the society.
The institute has been known as one of the Asia's largest and prestigious rehabilitation institute. What are the three major things that makes NIRTAR, now SVNIRTAR, this prestigious?
See, we are the only institute that provide deformity correction, surgical correction of the deformity in large scale in the country. Then number two, we get a number of outpatients for the rehabilitation of person with a disability. Per day, more than 700 patients come for outdoor therapeutic services. Then we have skill training also. Again, I'll say that is among all the government institutes, we are the largest in providing skill training to person with a disability, as well as some kind of employment, either wage employment or self-employment. Then our alumni are spread all across the globe. That is the one beauty of the
They
statue.
carry the flag high.
Yes.
Sir, one more thing. You said 700 people every day as outpatients. How much we charge to them? This is a government institution. So you said you treat every day 700 people.
Those who are having UDID card, that's a
The
disability
disability.
certificate, their treatment is completely free.
Completely free.
Completely free.
Right. So how many doctors are there with you who are treating patients every day?
In hospital, we have 10, 11 doctors. In physiotherapy department, we have 11 physiotherapists. In occupational therapy, there are about 10 occupational therapists. Prosthetic, orthotic, there are about 15 prosthetic, orthotic professionals. Speech therapy, again, we have around 10 professionals.
What are the labs that are very world class, so they are very cutting edge? What are the labs that you can show us so that we can understand what work is happening in those labs that makes SVNIRTAR as one of the world's well-known respiratory
Or
institutes?
physiotherapy, prosthetic, orthotic, and occupational therapy. And we have state-of-art labs in their all the departments.
We'll go to one of your labs next. As we continue our discussion and meeting with the students and faculty members at NIRTAR, here we have come to a treatment room where we have students who are pursuing their postgraduate degree in what subject you are doing that?
Musculoskeletal studies.
Right. What's your name?
Sir, I am Manvi Khatri from Maharashtra and I am PG second year student doing my masters here in musculoskeletal.
Why did you choose this field?
Sir, because physiotherapy has lot of scope these days. Doctors can only treat them, but we will rehabilitate them and we will bring them in a better condition to live their life. So
What opportunity you said the opportunities are opening up? So what
Sir,
opportunity do you see?
nowadays there is better scope of physiotherapy as we will treat the cause. Only medications can only treat the pain for some time, but we can eradicate the pain from the body. So I think physiotherapy is a better profession.
So why BPT is not enough? Why you have to do a master degree program?
So because with the increasing scope of the physiotherapy, now only BPT is not enough. We need specialized physiotherapists. So
What kind of research do you do?
Sir, we bring new techniques in the practice so that we can do better treatment and evidence-based practices. That's why important so that we can give better patient treatment.
Very good. और कुछ कोई कहना चाहेगा? कोई भी?
As we learn from ourselves, medicine is a thing, but we have manual. We have everything in our hand. So if we are good in our hands, we can do everything. We can cure our patient and our patient can believe. So we believe, we learn from ourselves that whatever we have in our hands. So nobody can snatch from anything from us. Because everyone can prescribe medicine or something, but if we are good in our hands, like ourselves is, so nobody can snatch or anything. So in this competitive world, every individual should have something in their own that nobody can
take that away. आपका नाम आप कहाँ से हैं?
So Samantha Float, I'm from West Bengal.
West Bengal. Very good. As our ancient wisdom says, शरीरम आद्यम खलु धर्म साधनम. तो शरीर पहले, उसके बाद कोई धर्म. तो इसीलिए जो डॉक्टर महांती अभी एक रेवोल्यूशन खड़ा कर रहे हैं, मास्टर डिग्री में रिसर्च ला रहे हैं, उसमें टेक्नोलॉजी इंटीग्रेशन कर रहे हैं. सो दिस इज चेंजिंग हाउ physiotherapy education and allied education is going to be looked at in the years to come. As we proceed, Dr. Mahanti, आप बताइए कि boys and girls pursuing this higher studies here. So after this, they have high hope to go to the market and they have opportunities to explore. How do you see master degree program as a step two? One is research, higher research, patenting and product development. At the same time, also self-employment might be at one place, but another level also getting jobs in the market. What kind of work, what kind of support you're providing to them?
The strength of SVNIRTAR is manual therapy, as I told. Physiotherapy, usually people apply various modalities, but in musculoskeletal painful condition, particularly in orthopedic medical condition, about 85% problems are mechanical in nature. When the problem is mechanical, again, only through biomechanical analysis we can find out what is the primary cause, and through manual therapy we treat the primary cause. Otherwise, in those orthopedic medical condition, if it's treated by medicine,
Only.
that will only kill the pain. That doesn't solve the biomechanical
Root.
malalignment and all the dysfunction, derangement, etc., which can only be achieved by physiotherapy. That root cause, we reach to the root cause. Our strength is manual therapy, where biomechanics play a very important role in all fields. This biomechanical knowledge is very important in all fields of physiotherapy, like in neuro, in pediatrics, in any field. The biomechanical knowledge is very important. So we try to strengthen the background knowledge of biomechanics among our postgraduate students, and we skill them in manual therapy. And evaluation, particularly the evaluation and the diagnosis through clinical method, without any investigation procedure also, our students are very strong. And so that what happened, if you go all across the country, you'll find NIRTAR alumni are almost everywhere. In all good hospital, Apex hospital, you'll find the NIRTARians are there.
Dr. Mahanti, please explain what is this lab and what is this high-tech technology that is helping you diagnose people and patients better?
This is a biomechanical lab where we can check the posture of the individual, we can check the movements of various joints, the loading of various joints, the muscle performance of various joints. So we analyze biomechanically, we give the treatment, and then after the treatment we evaluate whether the loading is changed, the muscle activity is changed, how much it is changed. It is also used for therapeutic purpose. One is evaluation and other one is the therapeutic purpose, like improving the balance, the posture, all these things. It can be also.
Dr. Mahanti, India is now emerging as this big sports destination. When we are going big in sports, and the Prime Minister is looking at Olympics and Commonwealth Games as big positioning at the world level. So, given your legacy of 50 years, how do you see the opportunity and challenge in sports injury rehabilitation? So, how these kind of biomechanical labs can be useful for that?
For sports injury rehabilitation, biomechanical lab is very, very important, because we have to analyze the biomechanically, you have to analyze the individual's activities specific to specific sports. If there is any abnormality, then we have to correct that, because if there is any body alignment change, if the biomechanical movement or muscle performance activities is changed, then obviously it is going to affect the performance of the individual. Then one may land in early injury. So biomechanical analysis, based on the analysis, the treatment, the training, the rehabilitation has to be performed.
Our athletes are people who are playing sports, elite sports like cricket and hockey and other games. They are going for rehabilitation to Australia or to England. Some might go to South Africa, some might go to the United States. What can we do to make a sports rehabilitation global destination that India should become?
The first thing is you should have the infrastructure, particularly those biomechanical lab is very important. Then the second is the manpower, the trained
manpower, skilled manpower, doctors and therapists.
Yeah, therapists and doctors.
The two things. Just need the infrastructure, high-end technology, and trained manpower with technology and skills.
Yes.
Thank you. We'll go to the next lab with Dr. Mahanti. Welcome back. We have come back to another lab now where the paralysis patients and spinal cord patients are being treated. So we'd ask Dr. Mahanti to speak a little more about it, and especially when paralysis problems are rising because of different reasons. So because of stress, because of stroke, because of several things. So Dr. Mahanti, why paralysis is happening and the number is rising? What kind of support you are providing through treatment?
This is a physiotherapy unit for rehabilitation of the spinal cord injury patient. We get around 100 spinal cord injury patient per day. And mostly the spinal cord injury is due to accident, the trauma, falling from height or road traffic accident. And nowadays, the more young people are affected by the spinal cord injury, probably because of road traffic accident, using high-speed bike, by riding the bike with mobile on. So these are the main factors. So after the primary treatment, the medical or surgical treatment, mostly accident traumatic cases, surgical fixes in return, so that rehabilitation can be started early. So we get number of patients after surgery or conservative management from various medical colleges. Like
They refer them to you.
They refer them, yeah.
Okay.
And this rehabilitation is a long-term process. One has to take the various therapeutic treatment for about 3 months, so that we try to improve those are partially damaged, their muscle strength, how to improve the functional activities, how to be restored. If required, aids and appliances we provide so that one should be made to stand, walk, and perform the various functional activities. Once our therapeutic treatment is over, then we recruit them in our skill training. And following skill training also, we facilitate them how to go back to the society with some job and maintain their family in a
Maintain the
healthier
physical fitness and contribute to the family.
We continue to go to different labs of SVNIRTAR. We are here into another very interesting lab where you can see that there is a child playing and an instructor is there who is making him play several things. So we'll come to the team head to explain what is this in this lab happening, who is the child and what is this lab about.
So this is Occupational Therapy Department OT lab. So this is basically we are taking an autistic child who is not interested to do anything, who does not know about the daily activities, as well as he was not able to speak and he was not able to go to the schools and all. After giving the interventions, the child has improved, and this lab is a virtual lab where virtual reality, based on the virtual reality, we are giving the intervention to the child. The child is interested to identify the different things. So in this virtual reality, the child is given different activities where the child feels that it is the natural thing he is picking up. So the instruction has been given to the child that you try to pick up the things, and the child is trying to identify the object and trying to pick up.
How old is the child now?
So the child is 4.5 years of child.
How many months or days have been the intervention?
So since 6 months the child has come here.
Okay, so there is an improvement there.
Yes, sir. The mother is there. Mother also can tell that how much improvement is there. So since the child had come, there was no language at all. The child was not speaking. Now he is able to identify the things. Now he is going to the school, and he is sitting in the school and he started writing. Even he knows about the alphabets, numbers, everything he knows. So that's how the child has improved to identify the things, as well as in academic part he has improved.
Tell us a bit about your work. What is your name?
Sir, I am Dr. Anurupa Senapati. I am head of the Department of Occupational Therapy. Basically, in the Occupational Therapy Department, we deal with all type of patients: neurological patient, neurological disabled patient, orthopedic, pediatrics.
A slow learners like.
Yeah, stroke, and most of the patients, especially comes to the pediatric section, including cerebral palsy. We try to handle most of autistic children as well as ADHD children. So per day, almost 100 patients used to come to our department, autistic children, those who lack their social interaction, communications and day-to-day activities.
This is a fascinating example how SVNIRTAR is integrating children and their challenges into rehabilitation process. What Dr. Senapati has presented here, it completes our story of SVNIRTAR, which has completed 50 years of glorious history. We are at a ward where small children or elderly people are treated. And now from Dr. Pavitra, we would like to understand what is this treatment, how the surgery happens, what is the deformative surgery, and how this happens, and very rarely in Asia or India, this is how NIRTAR has been able to create a special identity. Over to Dr. Pavitra.
Yeah, this is our pediatrics ward, and my institute basically deal with rehabilitation surgery and rehabilitation management. This is a teamwork where rehabilitation surgery along with other accessory departments, we collectively assess the patient and decide the protocol of surgery. These surgeries are a bit different from other surgeries happen in other institutes or other medical colleges. Here we mostly deal with the patients which are having severe congenital deformities and with some acquired deformities also. We get referral patients from the different medical colleges with severe deformity, children as well as adult people. And the difference between this institute and other institutes is that we treat the patient as a whole. We treat the patient deformity, and along with we look for the functional recovery. Unlike other institutes where they treat only the patient's deformity. So this institute is designated as a institute with excellence in rehab surgery, and this excellence is because of a teamwork.
And also the legacy that you have developed over the years.
Yeah, this institute has long legacy. You can say the deformity correction started here only. The technology, Russian technology, treatment by laser method, they started here only. My seniors, my previous mentors, they have started that type of treatment, and we are continuing the same.
What is the success? Because these are children, so they might have faced some trouble there. And what is the success rate after the surgery is done in their making them fully operational and functional?
Yeah. The treatment part is that as early as it is started, the deformity correction started.
Early intervention.
Yeah, it's always a good result. So we try to pick up the children from the early ages. Whenever they reach to us, we counsel them. We have the other department like early intervention clinics also. They are located there. Then we subsequently follow up the patient. Certain children, like they started treatment at 2 weeks age, like a clubfoot child. If it started at 2 weeks age, the treatment is 100% deformity can be cured. And we try our level best to make the child functional, irrespective of the disease.
Right. So the crux or the point of the conclusion here is that if we start early intervention, according to all our doctors here, the result is high potential, close to 100%, and high recovery potential. So it is for all of us to make our children go through the treatment if their difficulty is there from the very early stage.
This is a child around 7 years age having multiple congenital deformities. This is called arthrogryposis multiplex congenita, where the child has deformity from birth, having both side elbow stiffness. She cannot flex the elbow beyond this. She has poor grasp power. She has absence of 2 bones from the birth. She has deformity of both the foot, and she was unable to eat on the right hand because of this. The elbow was not flexed enough to bring the hand to the mouth. So it was a really difficult case. Had it been this patient present in early ages, say 1 year age, we could have done something. Since she has reported at 7 years age, she has gross knee contracture. The knee cannot be strengthened beyond this. So at this moment, the best way is to go for cut both the limbs, make a prosthesis. But parents are not ready for that. We are trying to prepare. In fact, we have prepared prosthesis of both the side artificial limb. She can walk with this bent knee straight way. And we have done surgery this side so that she can eat. She can bring the hand to the mouth so that she can eat. And this is how we are planning.
Sir, here you can see there is a child here. The treatment is going on. So we would ask the treatment department head to explain what is happening here. Sir.
This is a patient of child of the muscular dystrophy case, and it is muscle weakness. Muscles is getting affected. Muscle weakness is there. We are giving, this is the BT, Baltimore Therapeutic equipment. We are giving the strengthening activities by this equipment, and as much he is not able to.
How many days the treatment is going on?
It's coming last 1 month. He is coming attending this time.
So what has been the improvement?
Improvement. This is actually generally maintain the particular muscle cell. Muscular dystrophy is such a disease. Gradually, the deterioration, muscle power will reduce. So you want to maintain the strength as much as possible.
So it helps in bone strengthening, and
muscle strengthening,
muscle strengthening.
strengthening the upper extremity, upper leg strengthening. It is very difficult to maintain the strength.
Thank you so much. As we continue to look at new innovations at SVNIRTAR, 50 years on, small and big and high-tech, all interventions are available. Dr. Mahanti, as he was explaining to us, we have seen all the lab. We now need to see what is next for 2047 Vikshit Bharat, Vikshit Odisha. What is Vikshit SVNIRTAR's vision?
आपका क्या नाम है?
मेरा नाम आशुतोष साहू।
आप दिव्यांग है?
हाँ,
क्या हुआ था आपका दिव्यांग में?
मेरा लेफ्ट हैंड का पैरालिसिस हो गया है, वो नर्व इंजरी की वजह से हाथ नहीं चल रहा है।
लेफ्ट साइड पैरालिसिस से। ओके, तो आप ये मोबाइल रिपेयरिंग सीखे हैं?
हाँ,
कितने दिन में?
हमारे कल से क्लास शुरू हुआ है। आज सारे एक मोबाइल आई, इसको हम अभी खुले हैं।
इसका भी रिपेयर होगा।
कितना दिन में सीख लिया?
सीखा तो सारा थोड़ी में बता रहे हैं, जैसे बता रहे हैं हम उसी को फॉलो करके कर रहे हैं।
Now we are in the campus. We have visited all your labs, all your specially designed the high-tech labs, treatment labs. NIRTAR is a golden name in the history of Odisha and history of India. How it all started, Dr. Mahanti?
It started in 1975. The land was donated by one engineer, Brijaram Mesra. Then there are some NGO working over here. Then following Indo-Bangladesh war, the then government wanted to open one rehabilitation center, particularly for the rehabilitation of war victims. And this place was, since it was some Janta hospital was running over here, so this place was selected and this rehabilitation center then started.
Right. So in the 50 years, how do you see the institutional journey, and especially in the context of Viksit Bharat, how do you see SVNIRTAR contributing to that dream that our Honorable Prime Minister has set for all of us?
See, it was started as just only for prosthetic orthotic center. Then over time, it is providing complete rehabilitation of person with a disability. It was started for the rehabilitation of locomotor disability, but now we are providing rehabilitation services to all 21 categories of disability, including blood disorder, speech hearing, then intellectual disability, and all categories of
What's
disability.
next?
The next, we want,
The university?
A deemed university, because the manpower development is the primary focus. So to provide manpower and
Well-trained manpower.
of global standard, we want is to be upgraded to a deemed to university. The effort has already started.
Right.
And since 2014, the institute has developed. We have upgraded our hospital from 100 to 200 bedded hospital. Then vocational training center has developed. We have started speech therapy, bachelor in speech and audiology course also. So then now one auditorium, 1,000 seated auditorium with the help of Government of Odisha is going to be constructed. Government of Odisha also handed over 5 acres of land for the development of the institute.
Thank you so much. We are looking forward to NIRTAR's continuing role for developed Odisha and developed India. Thank you so much.
Thank you.